somebody had questions about why they've had treatment several times and it hasn't worked. One, if you have any contributing factors, as I just mentioned, bite problems, undiagnosed diabetes, certain bacteria which require certain products at home to use, okay? This is why you would have a problem, because these red ones will come back very easily, okay? The other problem that we have is that a lot of the modalities of treating periodontal disease today do not work well. Scaling and root planing or deep cleaning is pretty much a useless procedure, we know now, okay? And it won't keep the bacteria away for most patients, unless you're a very, very mild case. Traditional gum surgery, we haven't done since about 2004, I think is when we got our first laser. We stopped doing that procedure a long time ago. The difference between traditional gum surgery and the laser, so if I have two teeth, okay, the bone coming across should be flat, should hit the teeth at 90 degrees, okay? If I have something like this, right, where the bone comes across and as it gets towards the tooth it dips down and I got this pocket here, okay, that's where the pockets happen and that's where the bacteria accumulate, okay? When the hygienist is going in and doing your probing at your hygiene visits, okay, what they're doing is testing to see what degree of infection you have, all right? If I go under and take one of these probes and go underneath my fingernail, okay, it shouldn't bleed, it shouldn't hurt. When we go around your teeth and do that, it shouldn't bleed and it shouldn't hurt. If it does either one of those, there's infection, okay? The other thing that happens is if we get probing depths beyond 4, then that means there's infection there. Your fingernail works exactly the same way, right? I have a nail tissue underneath my nail bed that attaches. That's why I can only go in so far, right? Well, if I got a fungal infection underneath my nail bed to the point that my tissue detached, I could actually take this and go in further, right? You treat the gum infection, you treat the fungal infection, and the tissue reattaches and it goes back to normal. Well, when we can probe 4s and 5s, especially more than 4s, you have enough gum infection that the tissue is actually detached from the tooth. That's what the probings mean, okay? Now, our instruments that we use to do a deep cleaning, okay, only cover this area of the root, okay? Your gum's up here, and we can go under the gum and we can clean this part of the root. Our instruments do not fit into this space. So if you do scaling and root planing alone, then all this is left behind, and that's why it always comes back, okay? Now, there's 2 options you have to treat gum infection. The old school way of doing it is you have to get rid of this space, right? So, the old school way of doing a traditional gum surgery, take a scalpel, move the gum out of the way, take a drill, you drill the bone down, you get rid of that defect, okay? So you have to take away good bone and good gum in order to get rid of the defect, okay? Now, the old saying, getting long in the tooth, okay? Your teeth start to appear very long after this procedure, okay? And for 60 years, it was all we had, okay? But for the last 20, okay, we've had a laser. That is a much simpler and much more predictable process, okay? The laser will go in and get rid of the bacteria that's in that pocket, okay? And so there's no need to move gum out of the way or to get rid of good gum or good bone, okay? The laser is very selective. It will not affect, you can hold it against your finger, it will not affect good tissue. It only affects infected tissue, okay? And you essentially get regeneration of bone to fill this in, okay? So it's a regenerative process as opposed to a resective process, okay? Your post-op is night and day. It's very simple compared to traditional gum surgery, and the predictability of it, okay? It's got an 87% success rate, whereas opposed to traditional gum surgery is in the 20s, okay? It is the only procedure we have that is FDA cleared to treat periodontal disease, because it is the only procedure we have that is predictable, right? Traditional gum surgery we've been doing for 60 years is not FDA approved because the failure rate's too high, right? This is the only option we have to treat it successfully, okay? I'm going to go into a little bit about the 3D imaging now, because this also gives us information and goes into the predictability of can we save teeth or not save teeth. So in this case, you can see anything that's gold is solid structure, okay? Teeth, jawbone, it's all solid structure, okay? If I rotate around to the back, and you see this side over here, in the front, I have teeth and I have bone. It's all solid gold, right? As I go towards the back and I start to see black triangles, okay, and my bone goes from here up to here, okay? So these teeth are much less predictable, okay? Especially if they're creating mobility. This gentleman wanted to do everything he could do to save his teeth. And when we see this, then we know we got to split these teeth together somehow, some way, in order to stop mobility, okay? Because that's one of the biggest things that creates failure of periodontal treatment. If I have a 6 foot long fence post and I put 4 feet in the ground and leave 2 feet above the ground, that's very stable, right? If I took that picture and turned it upside down and put 2 feet in the ground and left 4 feet above the ground, I can move it with 2 fingers, right? So as you lose bone around teeth from the periodontal infection, like in this scenario, and those teeth are moving, okay, imagine a mailbox at the end of your driveway sitting in nice hard sand, and every day on the way out of your driveway, you bump the mailbox with your car. The mailbox starts to do this, right? The sand around that mailbox starts to change, right? Imagine the bone around your teeth like the sand around that mailbox. As you're hitting your teeth unevenly, and they do this, the bone changes. So you've got to control that mobility, because this person has, on one tooth, 50% bone loss, and on the other, 70% bone loss. So he's got this picture reversed. So you have to be able to control that mobility or it won't last, right? So you can do predictable periodontal treatment. You just have to address all the factors that are there.